welcome back. I'm Mabel Jong, and in our studio right now is Sheri Johnson, Associate VP, Member Enrollment and Billing of UCare. Welcome.
Thank you.
Well, you're based in Minnesota. UCare is an independent nonprofit health plan providing healthcare services and coverage across Minnesota. What brought you to HCEG? I understand this is your first time.
It is my first time, and I was really excited about a small conference where there could be more conversation and less just presentation.
Okay.
And so I'd heard about this group and thought it was time to check it out, and as I told Ferris, find my people.
Okay, and how has it been? Have you been finding the right people?
I have. It has been wonderful. I am new to the payer side of healthcare. I've been working at UCare about a year, and so actually finding those people that I called my people has been interesting, and being able to have those conversations one-on-one with the other attendees and the speakers has been wonderful.
That's terrific. What sort of issues do you have working at your company in Minnesota that might benefit from what you learned from other companies across the country?
I think within my function there are two big issues that we're dealing with, or opportunities depending how you look at it. One is the transformation of our technology. So our technology is older, and organizationally we're looking at how we transform that. And then it gets into the issue of priorities. So when everything needs to be new, think of your house. You have to do it one room at a time, but you want it all done today. So that's been challenging. The other thing I think has been member experience, and how we actually meet members where they're at and provide what they're looking for. So in some cases, members may say, stop sending me all of these letters, I don't want them, but yet it's a regulatory requirement that we send them.
Right.
So those types of issues around the member and around our technology are really the biggest things I'm dealing with right now.
Okay. What are some of the key takeaways that you've been able to hear from other members or other sessions that you've participated in?
I think two key takeaways. One has to do with data and the importance of data and how quickly data is changing. So yesterday we were at IBM Watson, and there was a fact about healthcare data doubling every 73 days. Well, how does anybody keep up with that? So that ties into my second takeaway, which is around partnerships. So how do you actually find those key partners? Because as a health plan, we can't do everything ourselves. So who are those key partners that we can work with to get all of the things we need to meet our members' needs?
Are these tools or strategies that you'll be able to put in place when you go back to work in Minnesota?
Exactly. I already have some vendor partners I want to talk with as soon as I get home, who have some unique offerings that I've learned about here.
Fantastic. Did you take a look at the top 10 list of member concerns or issues that people want to address?
Yes, and in fact the top 10 list is one of the things I was really excited about with this organization, because being able to be focused on 10 things instead of everything, and even the way this conference is formatted to really talk about the top 10, and it seems that every conversation is around the top 10, and I really like that.
Okay, Sheri Johnson, thank you so much for your time.
Thank you.
Really
Thank
appreciate
you.
it. Thank you.